बोन रिमूव कर दिया, सिस्ट दिख गया, यू हैव गेन्ड एक्सेस टू द सिस्टिक कैविटी, यू विल टेक एन इंस्ट्रूमेंट, यू विल टेक अ क्यूरेट, you will free the cyst lining, you will free the soft tissue cystic lining from the adjacent bone on all the four sides. Okay, you will free the soft tissue cystic lining from all the four sides here, and you will remove this cyst. You will remove the entire cyst, you will remove completely in toto, removal of cystic लाइनिंग. अब जब आपने सॉफ्ट टिश्यू लाइनिंग हटा दी तो आपके पास एक हॉलो बोनी कैविटी बचेगी, हॉलो बोनी कैविटी बचेगी. ओके, you will be left behind with a hollow bony cavity like this. This surface is bone. जहां अभी मेरा मार्कर चल रहा है, that surface is bone. Okay, and you will suture back the mucoperiosteal flap. You will suture back the mucoperiosteal flap. Okay, this is enucleation, complete removal. Cyst की lining नहीं आप छोड़ रहे हो bone में. All right. I hope Muskan, now the technique of enucleation is clear. I hope the technique of enucleation is clear. All right. We'll quickly repeat eruption cyst. There's nothing much to understand in eruption cyst. See what is happening. So when the tooth is in its eruptive phase, when it's in its eruptive movement, in case there's a cyst that is present which is associated with the tooth, but the cyst is present in the bony tissue. The cyst is present in the bony tissue like here. The cyst is present in the bony tissue like here, then it becomes a dentigerous cyst. But if this same cyst is present with an erupting tooth here in the soft tissue, then it becomes a eruption cyst. Okay, it becomes a eruption cyst. Now, if the bleeding occurs in this eruption cyst due to pressure from the opposing tooth, if opposing tooth keeps on pressurizing this, bleeding takes place here in the eruption cyst. Bleeding will take place, and this is known as eruption hematoma. So, what is the treatment for it? You sometimes don't need any treatment. जैसे ही दांत अपने आप erupt होगा, cyst rupture हो जाएगा and cyst will go away. Alright, sometimes it is spontaneous, but in case you feel that the eruption is going beyond the chronological age of the involved tooth's eruption, what you can do is you can create an incision in the soft tissue, you can open up the contents, you can evacuate the fluid or the hematoma or the blood, and you can excise the soft tissue around which is causing an hindrance to the tooth. You can excise the soft tissue and create a pathway for eruption of the tooth surgically. Okay, create a pathway for the eruption of the tooth surgically. Alright. I hope, Shivani, that's understood. Okay. Yeah. Priyanka, so what happens? Why it is important to remove the involved salivary gland? Because mucocele or ranulas are often caused due to rupture in the salivary duct. Alright. Or a stricture in the salivary duct. So, if you don't remove the involved salivary gland, the mucocele and ranula will keep recurring again and again. So, it is important to remove the associated salivary gland. Alright. Alright, Priyanka. Okay, we will now carry on with treatment of tumors. Okay, with treatment of tumors. Now, there were certain criteria given by a few people known as Gold, Upton and Marks. Gold, Upton and Marks. Okay, Gold, Upton and Marks. Okay, Gold, Upton and Marx, they gave certain guidelines for treatment of tumors, or they gave standard protocols. For treatment of tumors, they gave standard protocol. These three gentlemen gave standard protocols for treatment of tumors. Now, what did they say? Recontouring. The first protocol that they gave was recontouring. So now, what is recontouring? Recontouring is nothing but reshaping of the bone. It is reshaping of the bone to attain normal contours or normal curvatures. Alright, recontouring is, please write down, reshaping of bone to achieve normal shape, also known as cosmetic contouring, Examples where recontouring can be done is fibrous dysplasia, removal of exostosis, mandibular tori, or torus palatinus. So basically, any tumor or any bony overgrowth which is not malignant, which is not aggressive, but it has altered the normal contour or normal shape of the bone, you can just go there, remove the excess bony tissue, give it a nice contour according to the normal bony structure, and your treatment would be done. Alright, so the next treatment is curettage. Okay, next treatment is curettage. So like I already told you, it is nothing but just blind scraping of pathological tissue. Blind mechanical scraping of pathological tissue. It is done for non-epithelialized pathologies or pathologies not having well defined capsules or margins. Alright, it is done for pathologies not having well defined capsules or margins. Alright, so disadvantage is complete removal is not possible. Complete removal here is not possible. You're just blindly scraping. Alright, you're not excising the entire thing. आप पूरा कोई एक बार में नहीं निकाल रहे हो, बार बार scrape कर रहे हो. So complete removal is not possible. It is usually used as an adjunct treatment modality. Example, central giant cell granuloma. Why is an adjunct treatment modality? मैंने बताया था because it will decrease recurrence. So enucleation plus adjunctive treatment modalities हमने पढ़ा था. There we were using curettage with enucleation. So if this is used as an adjunctive treatment modality, then it definitely reduces recurrence, but अगर ये independently as a treatment modality use होता है, then there are high chances of recurrence. Then there are high chances of recurrence due to incomplete removal. All right. Alina, exostosis is nothing but bony growth, bony overgrowth. Okay, your torus palatinus, torus mandibularis, all these things are bony exostosis. All right, they're bony exostosis. Bony overgrowth, which is not malignant, which is benign in nature, is exostosis. All right, I hope that is clear.